providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what health care agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. This evening, we're going to be talking a lot about stroke care, stroke symptoms, the FAST acronym, and just a lot about stroke awareness. So May 2019 is American Stroke Awareness Month, and it's a good time to just, think about that in a way, maybe, and friends and family, just to see if there's any kind of change. What do I do? When is it time maybe to, maybe call 911 or take them to, an emergency center or hospital. We got a great hospital system we're going to be talking about this evening. So I think it's a good time to, jot down some notes. You can always go back to this show. We're on allcountyhealthcare.com's radio link there on their website and also Facebook Live. So without further ado, I want to welcome to the program Arlene Barrett. She's an APRN from Florida Medical Center, which is located in Fort Lauderdale. Arlene, thank you for joining me this evening.
Hi, good evening, David. Thank you so much for joining us, for allowing me to join you, I should say, and thank you for giving me the opportunity to talk more about strokes, which is a passion of mine.
Yeah, definitely. I've wanted to have you on the show for some time. So let's start out right with the credentials. So you're an APRN, and I kind of had that wrong when we were talking. I was
No worries.
ready to make you an ARNP. What's the difference?
So recently, the rest of the country had gone to APRN to encompass all nurses that have a master's degree. So Florida was the last state to make that change. So it encompasses not only nurse practitioners, but clinical nurse specialists, nurses that have a master's degree that are working in either data collection, they're midwives, they are clinical nurse specialists. There's several different areas that we work in. But as an advanced practice registered nurse, I actually see patients, diagnose, and I'm a part of the treatment team. Nice.
And thanks for explaining that. I'm learning my acronyms here, so
no worries.
I have another tool in my toolbox to use on this show, APRN. That is really neat. Well, I'm always learning stuff on this show, so that's one of the reasons I like doing it. Please tell the viewers and listeners a little bit about your medical specialty. So you're an APRN, but you work mostly in the neuro field, neurology?
Yes, so I work in neuroscience specifically. Just to clarify, APRNs, I was a bedside nurse, a bachelor's degree prepared nurse for 12 years, and then I became a nurse practitioner, which is an additional 2.5 years of education. I happened to, for lack of a better term, fall into neuroscience. I was working in one field, and when I changed jobs, I got invited to participate in the stroke program at Florida Medical Center, and I've been there for 5 years.
And it's now, it's a comprehensive stroke center, right?
Right. We've been a comprehensive stroke center for many years, actually. What I just got final confirmation of was that we became what we call a thrombectomy capable. So we have a certifying body, the Joint Commission, that came in and evaluated our program and said, okay, well, you guys are capable of taking care of strokes in the acute phase when they come in with clots that we're able to fix, give them the clot busting medication called Alteplase, or, like I said, take them out work with the neurosurgeon to take care of any hemorrhages that might be there. So we have a very comprehensive program and have been for many years.
I was going to piggyback a couple things you said there. So the amount of training and experience that you have is amazing, the amount of time. I mean, that's like 15 years you were telling me.
Feels like it, but like I said, many years in multiple areas as a bedside nurse, and I just decided that I wanted to go further because I thought I could do more and help more people on the advanced practice level, and I was correct. I've been very blessed to have the career that I have.
Well, that's comforting to know because as a consumer living here in South Florida, I know obviously a lot about Florida Medical Center and the care they provide there, but to have people of your experience, and you've been there for a little bit now too, and so that's good too.
Absolutely, and because I care so much about neuroscience, I didn't realize it was going to be a passion of mine until it became one. Actually, I have a neuroscience certification, so in addition to being trained in family medicine or family health care, I'm a certified neuroscience nurse. So all things neuroscience are under my purview.
That's great. We're here with Arlene Barrett, APRN from Florida Medical Center. A campus in North Shore is the correct full name. They are located in Fort Lauderdale. You might recognize the name. We have a lot of doctors and nurses and nurse practitioners as well, APRNs tonight. So on the show from time to time. Another thing you said, Joint Commission, so that thrombectomy, I know I'm going to mess that up a few times.
It's okay.
Thrombectomy capable hospital. So Joint Commission, I mean, that is a huge deal when they come around.
Right. That's a big deal, and it was very anxiety-ridden. But, at the end of the day, I was confident with the team that we have there that we were doing everything that we needed to do for our patients. So I was very excited when they came through, and, they looked at our team and looked at everything and just was very pleased with everything that they saw.
Yeah, you guys hit it out of the park because now you're thrombectomy capable.
Yes. So
that's great news as well. I had heard something about that, but I'm glad you brought that up. It wasn't in my show notes that I did and in my questions. So that is great news. I'm glad we could bring that news out to the radio viewers and listeners. So this show, the demographic, I think is more baby boomers and seniors. Have you seen the population change a little bit at Florida Medical Center? Because originally it was more of a hospital for the retired.
Yeah, there were a lot of retirees. A fun fact about Florida Medical Center and myself is when I first became an RN, I worked there. That was my very first acute care job. So I actually have personal experience. We did have a large amount of retirees. The condos across the street. So our population at that time was about 85 and up. Things changed, and our demographics changed, and our population is much younger now. Actually, our average stroke population is probably about 45 to 65 now. And we also do have some retirees still in their 70s and 80s, but a lot of our strokes are young in their mid-age, 45 years old, when they're still working and productive, and they've had a stroke.
Yeah, I've read a little bit about that as well. So I like fun facts. I'm glad that you brought that up as well. But yeah, the demographic has definitely changed there around Florida Medical Center. It's a busy hospital.
Yeah, it is.
I think it's over 400 beds, right? It's a pretty big hospital.
We're licensed for 459 beds, so we can expand to that many if need be. We usually like to keep it a little smaller, so a lot of our rooms are private now, which allows for more family to visit. We have relaxed visiting hours, so when your loved one is having a stroke or some other, serious critical diagnosis, you can at least have and spend time with them and be able to come in and be with them.
Because that helps the patient and the family, right?
It does. It does.
And it kind of helps you, too, because you can have someone to contact or communicate with, and,
right.
Because these people sometimes, strokes can be debilitating.
Strokes, we do open heart surgery, so it's very, nerve-wracking for them, so it's nice to know that you can wait in the waiting area. You can come in and check on your family member. Yeah,
that's great. And it's Florida Medical Center. I'm going to give out the info. We've been talking so much about it. The website is floridamedcenter.com. It's actually spelled Florida and then medctr.com.